At the time of that exam, I had been for a year and a half to 2 years in a GLP-1 for diabetes control. Interestingly enough, my A1C was 6.7 before I started using the GLP. It was 6.7 a month before I stopped using my GLP. So it had not helped anything in almost 2 years, but it gave edema because that's one of the side effects, possible side effects of.
How,
It's
how,
bad. You shouldn't be in ketosis. Low carbohydrate diets are bad. They've never been studied, by the way. There are there's documentation 150 years ago that people were using low carbohydrate diets to treat diabetes, 100 years ago to treat epilepsy. But all the noise that you hear from the scientific community is that it's a bad, that it hasn't been studied, and come to find out is not exactly true.
and Dr. Vasquez, really appreciate you joining me today. Thank you for taking the time. Um, my first question for you is, what can you tell us just a little bit about your working background?
Yes, next month it will be 40 years I graduated from medical school. I did a family medicine residency, and I've been practicing or being a medic for 40 years, and with a specialty in family medicine for 36, 37, something like that.
Wow.
Uh,
Tell us about your diagnosis then, when you were diagnosed with cancer, and how did you manage that?
so uh, it's November now. About 3 weeks ago, perhaps, it was a year I diagnosed, almost a month now, since a year before that. I got up one morning, went to the bathroom, and in the darkness, I realized I was peeing blood, or at least it was a very reddish urine.
Mm.
Now, interestingly enough, I had a some sort of soft drink the day before. Had a lot of reddish color in it.
Okay.
So for a moment, I thought, okay, maybe uh, that's a result of the drink. But of course, I learned in medical school that painless hematuria, painless gross hematuria, which is the case when you grossly see blood in the urine, uh, has to be considered cancer until proven otherwise. Uh, there's no two ways about it. If you see blood in the urine, you have no pain, you don't have fever, you don't have sense of anything else, then you have to be worried about cancer. And so immediately, I think the next day, I had a urine test done. Uh, of course, there was plenty of blood there. Urine culture was negative, and within a few days, I had to have an MRI of my abdomen and pelvis. And week 10 days later, I basically knew that this was not good news. It was a bladder cancer. Um, had a really small tumor in the bladder. It was, I believe, less than 2 inches. And finally got a hold of a urologist to see me, and had what's called a cystoscopy right there in the office that day. And My wife was with me, and the doctor, all looking at the screen. And of course, as soon as we saw it, as soon as the doctor and I saw it, I knew this was not good.
Yeah.
Uh, Still took about 3 weeks to have surgery, and I had it removed uh, Monday before Thanksgiving. So we're coming up on the anniversary of that surgery. I fasted before that surgery for about 2 or 3 days. I
Hmm.
make sure that while I was asleep, anesthetized, that they didn't give me any uh, dextrose or basically sugar. And of
Yeah.
course, we'll most likely talk about that a little bit later. But uh, so I had that removed. Again, after pathology came back, uh, I gathered my family, my kids, my daughter-in-law, uh, and told them what what was going to happen in the next few months. Took, for one reason or the other, took uh, almost 2 months to get my first treatment.
Okay.
Uh, Bladder cancer, the number one associated risk for bladder cancer is smoking. I have never smoked in my life. I'm 64. I was 63 at the time.
Yeah.
Uh, I had not smoked all my life. It's the number one associated cancer. But of course, there are other environmental issues, and
Yeah.
we can go down the rabbit hole talking about different toxins in the water and the environment, in food. My belief, this was a result of years of processed food and metabolic dysfunction.
Yeah, I think so too. I mean, when I was going through my first diagnosis, I was like, what could how could this be? How could, trying to analyze what could have caused it? But honestly, these things are like decades in the making, really. Decades of abuse and just the wrong diet, and just there's so many things that accumulate and cause these things.
So finally, February this year, uh, I started treatment. I went through the usual treatment of choice for that. Now they had removed the tumor. There was no residual there, according to the pathology report. So the treatment was more as a prophylactic
Yeah,
measure, because it decreases. Studies have shown it decreases the chances of coming back, and it can come back, of course, as you know a little bit about your story. It can come back regardless
yeah,
of what you do sometimes. But so I had the treatment for bladder cancer is the injection of uh, BCG. For people, just to make it a short, simple answer, it's actually tuberculosis being injected into your bladder to trigger an immune response of the body to attack the cancer cells. It's been the treatment of choice. There are other treatments, but it's been the treatment of choice for, I don't know, 30, 40 years, the standard of care. But along with that, early in the diagnosis, I had contacted Dr. Thomas Seyfried. He graciously had responded to me. I don't know, within 72 hours, I had a response from him. I had contacted Don D'Agostino, uh, contacted a few other people. Dr. Chafee, by the way, uh, with specific questions for all of them. Dr. Seifried sent me, he's got a whole package he sends to people who are looking
Yeah.
for help. He's not a medical doctor. He makes it clear
Mm.
that, he's a professor and research fellow. So
But he's a great guy.
I,
He's very generous with his time too.
yes. So I put many of those things into practice. So I was actually fasting 48 hours before my treatments. It was once a week for 6 weeks. So I was fasting 48 hours before treatment and 40 after treatment. I was at the same time uh, using 8 natural supplements that have been shown to be glutamate inhibitors. Um, Used them all, and I do have a list. I can send it to you if you don't have that resource. But so fasting throughout before and after treatment, I was using these supplements on a press manner, like Dr. Seifried uh, suggested. The rest of the days when I wasn't fasting, I was very low. Well, I was pretty much carb free. I was pretty much carnivore at that time, and so I was using also some exogenous ketones along with this treatment on just the days. I would start the day of the treatment for 3 or 4 consecutive days each week. The only thing I wanted to do that I couldn't get worked out was hyperbaric oxygen therapy.
Yeah.
Interestingly enough, hyperbaric oxygen therapy is approved by insurance once you have radiation damage bladder from whatever radiation treatment you've had. They'll cover that, but they don't cover the same hyperbaric chamber uh, oxygen therapy to treat things like cancer. Anyways, we have a sort of little bit of a broken health system, I think. Uh,
Yeah.
what else? Oh, I was using an electromagnetic frequencies device, which I had used earlier to help me with a stroke I had in 2018. So I did that for 6 weeks. And long story short, about a month and a half ago, I had a follow up CT scan. It's clear. So far,
Wow.
so good. So now I am 1 year since having my surgery.
That's fantastic. And basically, all you did was 6 weeks of treatment.
Yes, that 6 weeks of treatment. And I have to follow with the doctor because he had mentioned he wanted to do one more. Uh, I don't know if he was talking about just a one time or just a series of 2 or 3 weeks as a preventative as well. I'm due to go back and see him. So that's all. What have I done since? Well, I have continued to maintain a very low carbohydrate diet. I'm carnivore. Yeah. I I do have early to occasionally I might have pickles or olives or an avocado, things like that. Very very little, if anything, on the rest.
So tell us about. Now you mentioned you're part of that treatment. Um, you did press pulse and you did something else that was electromagnetic frequency healing. Tell us a little bit about that.
So many machines in the market. So I usually don't like to mention the brand of this particular one because I'm not trying to sell you anything. But uh, there are many similar machines. Of course, each one claims to be the best. But electromagnetic is basically uh, this particular one, at least. There are hundreds of studies to back up the effectiveness of that machine. The main thing that it does is increases your circulation, and they very nice videos with microscopic uh, images showing how circulation improves. How I came to have that machine and use it 6 years ago, I had a stroke, and I was walking with a walker. I had weakness on my right side. I am right-handed, and that was this side that was affected. And I wasn't able to even eat with my right hand. Good if I forced myself, but it was more comfortable eating with the left. And I have this friend who kept bugging me about showing me this thing until one day I said, "Okay, come to my house tonight. We'll talk." And he came with actually someone who is a nurse and showed me this device and said, let's just give you a session. It was I think 60 minutes or 20 minutes on the machine. And up to that day, I had been walking with a walker, not even a cane, because I needed the walker to be able to walk, balance, and all that. Uh, my gait was affected enough that if I try to walk with just the cane, even at that point, I would probably fall. So I sat down. They used this thing for a session, and I'm still thinking to myself, this is probably another gimmick.
Yeah.
I didn't know anything about this machine. Actually, I had been shown that machine or two before by someone else who kept insisting, and just to humor them, I let them show it to me, but wasn't convinced. One session in my living room in front of my wife, and I think my son was with me, and my dad was sleeping uh, at the moment. But I did one session, got up, and I started walking. I have not used the walk since because I had immediate improvement. Now, this is not something that's gonna do that almost miraculous thing, and the next day you're gonna be the same. No, it's something that you might need to continue to use, basically improve circulation. But so for the next few years, I used it on a daily basis. So I think it did help me improve probably up to 90-95% recovery from the stroke. Still have had some symptoms, still a bit of weakness on my right hand side and my leg, which have improved when I went from very low carbohydrates to pretty strict carnivore. Uh, so that sort of took it almost all the way. Now, do I have still I cannot run because I would trip and fall because I am still not able to. But now I don't notice any difference between my legs and my arm strength,
That's
and it
incredible.
is yeah. So
To
there are
have such,
some studies also with that machine and cancer. I'm not gonna claim that that's something that's gonna cure anybody's cancer, but if you think about the effect of increasing circulation, your body will be able to fight better the cancer when you have improved circulation to wherever part of your body you need those
Yeah, I
blood
agree.
cells and
Circulation is so important. This is something I talk about too, is circulation a lot, because there's so many conditions that are related to circulation, not just your blood system, but your lymphatic system. It's so important for so many things, it's just for healing in general. That to me, like your that in one session, that is absolutely remarkable, just from a frequency machine. That's I quite firmly believe in the frequencies as well, because we have frequencies, sound frequencies and things like that all around us that affect the body, and circulation as well. That's what is great for meditation. You sit and listen to frequencies and things like that. Um, that's mind blowing, actually. That how much that had helped you in just one session. Um, Yeah, and I agree. For cancer, it is circulation is, I do circulation exercises every day, like deep breathing and things like that, that really do help a lot, actually. That's amazing. So,
another. You just reminded me. There is something else I do which I used to not, and I stopped doing it. I've been doing it more, and I don't have a sauna. I don't have a cold ice bath type of tub, but I take a shower with as hot as my heater is set up, and then I turn it off or turn it down to cold for at least 3 minutes. I do that every day. It's basically my hermetic therapy. Uh, and I know my body is feeling it for two reasons. Usually, about 2.5 to 3 minutes, I start shivering a little bit. And it doesn't have to be extremely cold because I'm in Florida and the summer doesn't get cold here, right? But just the difference in temperatures between the cold does have an effect on me, and I can see it also. I wear a continuous glucose monitor, and I can see the rise of blood sugar when I do that, which is what's going to happen. I mean, you're putting your body under stress, and that's a good glucose spike, if you would. It's
yeah,
not that severe, anyways.
yeah. No, I do the same. That's a very similar thing. I don't have an ice bath, but I do a treatment, and then I do like a straight cold shower. So I'll have a bath for 20 minutes for as hot as I can stand it, with the mineral salts, and then I'll have a straight cold shower, and it gives you the same effect because you go from such extreme temperature difference. Fantastic for circulation as well. Just it really feels good. You really notice the difference. Um, Now, you also mentioned the carnivore diet. So I mean, and I can imagine you being a family doctor, you're obviously not in the greatest of health at the time. You had a stroke. Obviously, you would have had some other conditions that led to that. What eventually led you to the carnivore diet?
All right, so let me go back 30 some years. I I had read back in the early 90s, I think it was two probably, one of the Atkins books. And from the first moment I read it, I was sold hook, line, and sinker about low carb. Um, I've used it since then several times to lose weight. Of course, how do we regain the weight? Well, I stopped doing it. Since then, I have advised my patients the first thing when someone is trying to either lose weight or control their diabetes, you know, you need to cut the carbs, you need to cut the grains, you need to cut amount of carbohydrates, and that was always the beginning of my advice.
Yeah.
Unfortunately, I wasn't exactly following myself. I hit in '91. I know for sure I had hit over 320 pounds, and I'm
Wow.
five between five, like about 5'6.5" or so.
Wow.
So I had hit 320 pounds. My ideal body weight will be at least half of that at the most. And throughout the years, yo-yo dieting with low. I also did a bunch of other crazy diets, which anyone who struggle with weight knows. Uh, they have tried a bunch of uh, unorthodox
Yeah.
diets, right? And so by the time at the end of 2022, I was sick and tired of being sick and tired. And yes, I had diabetes, I had hypertension, I had the stroke in 2018. By the way, the stroke was a combination of uh, having hypertension, my
Yeah.
triglycerides were high, my good cholesterol, which good cholesterol has never been normal, not even 40. Uh, it has always been in the 20s or low 30s. And I had the stroke having somewhere about that. And LDL may have been a little bit elevated. I don't think an isolated LDL with everything else normal might be associated with a little bit of risk, but it's insignificant when you compare to the risk of just having diabetes, for example.
Yeah.
And the worst combination is high triglycerides, low HDL, and the LDL being maybe a little bit high.
Mm.
So all those factors were present when I had the stroke, and I had developed the habit of having drinks every day. So because I was always tired, I was always needing to wake up. I'm seeing patients, so feeling with lack of energy. I was doing that to an excess, and all those things caused a stroke. I don't think there was one particular thing, but if anything, I am sure of is that the initiating event was inflammation from my liver and elevated levels of insulin being at the start of that cascade of events.
Yeah. Yeah, for sure. Yeah, like I said before, it's always a combination of things. It takes a lot of things to actually cause these things, and it's no, you can't really pin everything down to one sort of causal event.
Yeah.
But
So at the end of 2022, I said, okay, I'm going to lose weight, control my diabetes numbers. And I went on a low carbohydrate diet. I already knew what to cut. Uh, Lost about 20 pounds by April. Uh, in April, I said, okay, I need to be more strict. Lost about 20 to 25 pounds in 2 more months. And then on June 12th, I have my eye exam, and they find that I have macular edema, which is swelling in the back of your eye, in the retina, over the macula, which is the most sensitive spot
mm,
in your retina. And of course, that can happen with diabetes. But I had regular exams before, and that had never been present. At the time of that exam, I had been for a year and a half to 2 years a GLP-1 for diabetes control. Interestingly enough, my A1C was 6.7 before I started using the GLP. It was 6.7 a month before I stopped using my GLP. So it had not helped anything in almost 2 years, but it gave edema because that's one of the side effects, possible side effects of.
How did, how did that make you feel? Like, you're a family doctor, you prescribe medicines, you prescribe these drugs for a long time, and you just found out, like, after 2 years of being on this GLP medication, that it has done nothing for your diabetes except maybe cause a problem with your eyes.
Not only didn't do anything for the diabetes, but for the weight, it had not done anything either because I was about the same weight before I started. And maybe initially it may have helped with 5, 10 pounds, which I regained while using it. And it wasn't until I changed what I was eating that I started to lose weight. So I don't feel it helped me for anything as far as the weight is. Didn't help me for diabetes control because I was already under 7%, which is what most doctors are going to tell you. Okay, if you're under 7, your diabetes is well controlled, right?
Yeah.
Uh, but it didn't change. Objectively, I had the exact number on my hemoglobin A1C before I started and when I finished. So it had not made a dent. When I stopped the GLP-1 and I, at the end of June, decided to go all the way, or it took probably 2, 3 months when I repeated the A1C, and it was 5.4, and it's been 5.4 since then. I've had it 3 times since then, and it's still 5.4.
Yeah.
Along the
So,
way, I lost over 100 pounds. I decreased my insulin use from 300 units a day to barely 10 to 20. I still need to use a little bit of insulin because my pancreas is exhausted and it's not producing much insulin anymore. Dropped total of 7 prescription medications I have stopped
wow.
since I went carnivore. Completely eliminated my blood pressure medications, which were at very high doses. So I
Mm.
totally reversed my hypertension and a bunch of other stuff.
So again, how does that make you feel after you spent a lifetime prescribing these drugs for your patients, and or you when you go carnivore, you're now off all these medications yourself, and obviously that didn't help with blood pressure, diabetes, A1C. So, do you think this experience has made you a better doctor, or it's giving you experience now? You know what it feels like, or
Well, like, yes, I think that's made me a better doctor, but uh, I'm saying this at the same time. I have to be maybe a little bit ashamed of not having done this before. Uh, for many, mixed messages. Even after I had read about uh, my initial experience was multiple editions of the Atkins books, and but then so much noise from the other. Oh, it's bad. You shouldn't be in ketosis. Low carbohydrate diets are bad. They've never been studied, by the way. There are there's documentation 150 years ago that people were using low carbohydrate diets to treat diabetes, 100 years ago to treat epilepsy. But all the noise that you hear from the scientific community is that it's a bad, that it hasn't been studied, and come to find out is not exactly true.
yeah, it's not true
So,
at all, is it? It's probably one of the most studied diets in history, really. If you talk about like
yeah.
the ketogenic treatment for epilepsy, Dr. Salisbury treating, things like, um, you know, for infections for soldiers in the Civil War. The French actually used it for scurvy, used horse meat, things like that. But also one of the most hidden ones, the Bellevue study from Thomas Stephenson as well. That was just a meat and fat diet that he learned to eat from the Inuit. He spent so many summers and winters up in the Arctic Circle. So it's very much a well-studied diet compared to.
It is, and there are many reasons for it. I think well thought out scientific theories, and I'll give you an example which relates to, which I know is one of your interest in having this podcasts is when you have you had a PET scan?
Yes, yeah,
You
quite
did,
a few. Yeah.
and you must know what is the radio tracer or the radioactive compound that they use for to do the PET scan, right?
Yeah.
It's a glucose analog, okay,
Mm.
called fluorodeoxyglucose. Okay, so it's a radioactive tracer they inject to you, and then they take pictures with a gamma camera, and then they also do a CT scan to pinpoint any cancer in your body.
Yeah.
Now, why is that? Because cancer cells absorb glucose
Glucose.
to 10, 20 times, sometimes more than regular cells in your body. Then their need for glucose is extraordinary.
Mm.
The cancer cells have 11 times more insulin receptors than regular cells in your body. And so cancer needs glucose to meet its energy demands. There are cells that are growing uncontrollably. So, unfortunately, we also need glucose to the point that we don't need to eat it. We don't need to have it. It's not an essential nutrient for us as far as ingesting it, but our body produces all the glucose that we need for when we need it, right? And many
Exactly. Yeah.
people are confused. Oh, you need carbohydrates to live. I hear that all the time.
Yeah.
You can have them if you want, but you don't need them to live. You do need things. There are certain amino acids, certain fats that you need. If you don't have them in your diet, you will die.
Mm.
If you don't have carbohydrates in your diet, it doesn't matter. Your body will make the glucose out of what? Out of the protein and the fat.
That's right.
So uh, I think, and I became aware of Dr. Seyfried's work about 8, 9 years ago. Uh, and of course, if you find out about Dr. Seyfried, you find out about Warburg, right? And
Mm.
their work. So I think cancer is a metabolic disease, and that's the initiating problem. And then down that stream, you will find that it causes genetic mutations. Even if you have a genetic predisposition to cancer, like for example the BRCA, it's still the metabolic influence, I think,
Mm.
that will lead you to manifest
Yeah.
those
Yeah, I
cancers.
agree. I mean, we all have these predispositions for different conditions, but I mean, it's
Yeah,
only going to happen if you damage your cells. So
yeah. We
yeah, you
actually
can.
everybody every day of their lives is dealing with what could be a cancer cell, right? Because
Mm.
we have damaged cells. We do have mutations in a cell, and usually our body is very good at identifying. Okay, this cell is active. Let's break it up. Reuse the materials to make healthier cells, right? So we might have one or 100 cells. It's not until that switch is turned off to stop that replication that then you might develop cancer, which might, this metabolic theory of cancer is not denying any genetic problems that we have identified. I think it's a metabolic disease. And yes, there might be problems with genes, but there are cancers that don't have any genetic mutations
That's right.
that they have found out. And so I do believe, come to believe that cancer is a metabolic disease, is very involved. I mean, I'm only 1 year out from my diagnosis surgery. I did have the lowest stage uh, for cancer, but the rest of my life, I'm gonna be following a very, very low carbohydrate diet. There's no question about that.
Yeah. So you're completely sold on the carnivore way of eating then?
Yes, and listen, I was born in Puerto Rico, 1960. My parents are both from out in the country. My father was born at the top of a mountain where, to this day, we get to that piece of land except by foot or a horse if I had a horse. There's no cars that still go there. My mother was born in the same town in the valley, but they come from very humble beginnings, and they're children of the Depression as well. And when I was growing up, my mom actually cooked most things. She went to the market, bought whatever she was going to cook, but gradually, of boxes or cans, bags of food were increasing.
Yeah.
I was also exposed to a vegetarian diet very early. We did eat meat at home, but very often we were eating meat substitutes. We call them veggie meats, right?
Yeah.
And when I look at a can of that now, and I see that it literally has about 37 ingredients, or I don't know, it's ultra. Talk about ultra processed foods.
Mm.
Making fake meat is the most processed thing you can have.
Yeah.
Definitely. Seed oils, refined sugar, refined oils, everything.
Yeah. Chemicals or the amount of ingredients they put into these foods, these things are so processed that even though they try to mimic meat, they can't produce the nutrients that come in a natural food like meat or even
Yeah.
homegrown. Even if you are vegetarian, if you grow it yourself, sort of thing, it's still going to be a
Yes.
lot more nutrients in it than buying it from these ultra processed foods.
Yeah. One of the names of one of these fake meats is Impossible Burger, right? I think it's
Yeah.
impossible to think that you can substitute that for
Yeah.
real meat. And don't get me wrong, I believe you can be healthy with even a vegan diet. there's some inherent problems with certain nutrients that you cannot get from plant matter. But a properly designed vegan diet where you supplement your needs and you're eating real foods is going to be very different than a diet that depends on box bags or cans.
Yeah.
I have
Well, I
I
believe you can
have
be
officially,
healthier. Yeah.
well,
Like you can be.
yeah, no, I'm not saying it's a bad diet. I think I feel better because I've been vegetarian
Mm,
uh, for long periods of time. Sometimes I don't think I was ever a strict vegan, but certainly vegetarian for long periods of time. And the last I was
yeah.
a vegetarian and finally gave up. One day was it was Thanksgiving,
Yeah.
and
Yeah. Thanksgiving is a dangerous time.
so yeah, you can be healthy more than one way. But I have reversed my hypertension, major risk for strokes and heart attacks. Right,
Mm,
my A1C is 5.4, and even if I'm not going to be able to claim that I have completely reversed or cured my diabetes. You can tell me I haven't seen any significant risks at the moment because studies have shown that if your A1C is under 5.7, 5.6 or less,
mm.
you basically have the same incidence as the rest of the population for having all cause mortality, for having cancer, for having cardiovascular diseases.
Yeah.
Okay? As soon as your A1C hits 5.7 and above, that curve goes right the incidence of all these things. So uh, can I decrease my risks even further? Well, maybe if I lost another 40 pounds, I need to lose, but I've been sort of stuck for a while. I think for me, this is a set point in my life. I'm not saying that you cannot break through your set points, but sometimes it takes a long time because
Mm,
I'm back to the weight I was in high school. I'm back to the weight I was when I got married. I'm back to the weight I was in medical school. I was actually lighter in medical school, but this weight I am now, it's a wall that I've had for a long time, and I'm just staying with this diet. I'm not get this change.
yeah.
If I get to lose the additional 40 pounds, great. If I don't, I've lost 120 since my heaviest. So
Yeah. That's impressive too. But your body takes time to adjust and heal as well. So I always tell people don't rush it. Just stay with it. Just trust the diet. And I mean, sometimes you can make small changes, like eliminating dairy, for example. Dairy's usually has carbs in it as well. But generally speaking, if you just stick with it, eventually your body equalizes and it'll start dropping more weight as you go. Um, it's a complicated thing, and it takes time for your body to heal as well, especially after everything you've been through. Your body is still going through a big change. It's incredible. So, what is? I mean, how has it changed the way you practice then? The way you practice medicine?
well, I one of the things. I mean, I was always advising people that the thing that they need to do is change their lifestyle. Maybe I wasn't giving them enough tools when I said that. When you go to the doctor and the doctor says, well, eat less, move more, go
Yeah,
out the door with this prescription, maybe I spend more time talking about life changes. Uh, so that's a main focus change, because I am not going to give you medication just for the heck of it. I usually discourage people who come to see me just requesting nowadays what's the most requested medication? GLP-1s, right? Oh, I want to
Yeah.
lose weight. Well, why don't you want to lose weight this way? And we talk about it rather than using a GLP, because guess what? A low carbohydrate diet does everything, 100% of what you can do with the GLP and GIP ones. We have those hormones in our body. These are also not com- as opposed to typical pharmaceutical medicines. It's not even there are medications or substances that our body doesn't produce. No, all these hormones, our body produces them.
That's right.
And even if you're a strict keto, a low carbohydrate diet do everything that the GLP ones can do, but multiple factors. Very often, even if they don't realize, they are addicted to the carbohydrates and the processed foods and the sugar. Oh no, I cannot stop having my bread. I've had
Yeah.
people tell me more than once, I'm not gonna stop having my bread. I'd rather die. Okay. You know, when I'm in this with a patient, uh it might be 10, 15, 20 minutes. Usually don't have more time than that. I'm there to decrease the risks
Yeah.
of dying or having serious injury, right? uh Number one, we're all gonna die. We don't know when. That's a reality, but we would like to be alive for as long as possible with the least amount of damage to our body as possible, right?
Yeah.
So when you're in the room and your blood pressure is 230 over 140 or something like that, well, you have a major risk of having a stroke and heart attack and dying from that, right? So we're going to talk about how to reduce that blood pressure. And at those numbers might be an emergency as far as we need to start some medications right now, right?
Mm.
Uh, in the long term, used to be that, oh, your LDL cholesterol is high, and some doctors will take the approach, you got to be this medication, otherwise you're going to die.
Yeah.
Uh, I was never one of those. I've always been very bad, you could say, about having everybody on statins. Um, when I graduated school, which at the time, I think the total cholesterol normal number was 300.
Yeah.
Now everything over 200 is flagged as abnormal.
Mm.
So it has changed. The normal limits have changed since then. But we do know through studies that there are certain things that are more associated with risk than others. Having type 2 diabetes, for example, is about an almost 1100% increase in risk of having heart attacks, strokes, and overall mortality and cancer. I mean, the amounts is huge. Having a
Yeah.
little bit of LDL elevated, number 11 in my list of things. Eight of those first 10, top 10, are related to sugar. The only ones that are not related to sugar is really smoking
Yeah.
and inactivity.
Yeah.
Everything else is pretty much related to sugar. Even the cholesterol numbers get influenced by your sugar metabolism. And I'm talking about sugar when I mention glucose, and I'm talking about sugars whenever any carbohydrate turns into sugar. So,
Yeah.
uh,
Well, the liver produces fat when you eat too much glucose, and you get fatty liver, and LDL is basically just lipids with a low count of nutrients. So you need a high nutrient diet to get more HDL. Yeah. Um, these are things we just. I think most people just don't understand this. We all want to. I think most people want to be healthy, and like you said, that they get set in their ways. A lot of people do, even though they want to be healthy, they kind of are very stubborn when they get into like lifestyles that they don't want to change. They won't give up their bread, for example. Like I've seen it too. Diabetics will they would rather lose limbs than change their diet. Change their lifestyle.
I've seen.
It's Yeah, addictions are real.
Yeah.
And yeah, it's just unfortunate, but you plant the seed and hopefully they'll make the change, but unfortunately people don't change very quickly.
Yeah. I have a bunch of first cousins, right? And we have a chat, all the ones that kind of grew up together. And someone posted a picture of a persimmon. Okay. You see Monsar?
Yeah.
Okay. It's a little orange fruit. Uh, it's very good. It's delicious. It's delicious. But
Yeah, I
I
like them
looked up
too.
I looked up the amount of carbohydrates in a persimmon, and it's 31 grams of carbohydrate. Now that's
Wow.
almost 8 teaspoons, 7.75 if you want to be exact, almost 8 teaspoons of sugar. I don't say I don't like it. I've liked it always.
Mm,
Eating too many fruits or any fruits will have a glucose spike,
mm,
and then my blood sugar is going to stay up for a long time. So I rather not eat it. So I made a comment. Well, that's 31 carbohydrate. Oh, but it's so good. It has vitamins and antioxidants, and all right, I love it. Still poison to me.
yeah.
That doesn't change the fact that it's poison to me. That's how I treat most foods that I know I shouldn't consume, because otherwise I'm going to be back. My A1C many years ago has been as high as 9, 10, 11. And the only thing, there's no medication that's going to change your A1C in this case so much that now you're going to be completely normal. There's no medicine, it doesn't exist. The medicine that exists is you changing your lifestyle, you changing your diet. And of course, if we're going to talk about blood sugar, we need to talk about sleep and stress and all these things that are not necessarily the food that you eat, but they
Yeah.
also have effect.
Yeah.
So I can't eat them anymore. I could eat them. Nobody's stopping me from eating them, but then I'm gonna have to deal with the consequences for having
I
5
was the
minutes of
same. I was the same before carnivore. I was the same. Like, oh, fruits are great. They got antioxidants and that sort of stuff. But I didn't realize that when you eat them though, they actually oxidize when you digest them. So that actually you don't get any antioxidant benefit from fruit. Um, but it's just one of those lies that we get told, and we grow up believing in as
But
well.
even if you did, the amounts are so
The
minute, number
minuscule,
one.
yeah. Mm,
And if I tell you, oh, you can have this full of vitamins and full of, there's vitamin C and there's all these things, it has half a cup of cyanide in it.
yeah,
I mean,
that's right.
to me, yes, it could have, it has fibers, it has all these nutrients, but it comes with the 8 teaspoons of, and that's going to be more damaging to my body than the minuscule amount of other nutrients that it may have. And
Yeah.
say may, not because it doesn't have them, but because we need to talk about, like you mentioned, what is it that you absorb? What happens
Yeah.
in your intestine when you digest them? Do you absorb all that? Is it bioavailable?
Yeah. And what does that sugar do to your liver and other things? So,
Exactly.
mm. um, Now you mentioned some other lifestyle changes. What are some of the lifestyle changes that you now recommend and that you use yourself outside of diet?
Well, you definitely need to sleep, and you need to sleep well. So if you're not sleeping well, now, some people got to be 8 hours. Well, what if you can only sleep seven? That's not a deal breaker for me. Some people just never sit past 6 hours, but you
Mm.
need to have a good night's sleep. One of the things that sleep a lot is obstructive sleep apnea. So this is something that you have to consider. Uh, Obstructive sleep apnea is a risk for diabetes, uh, congestive heart failure. These chronic, non communicable diseases are going to increase when you have sleep apnea. So it is important, if you're snoring, particularly if you stop breathing, you need to be checked. Uh, so you need to sleep well. And we all have stress in our life. We're going to have stress. You're going to have stress uh, at work. You're going to have stress at home. Now, thousands of years ago, people had stress when they were being chased by kill them and eat them. It's not
Yeah,
the same stress, but we do have all kinds of different stress, and you need to learn how to manage your stress and how to try to decrease. Sometimes there are many ways you need to handle. Um, I think one of the terrible things that happens when the world is, when the world is awake now for 24 hours, and you could most of the night, either by necessity because you work at night,
mm.
or by choice, just wasting your time on something else and not sleeping well, that causes a lot of damage to your system. We need to
Yeah,
recognize it. We need to learn to manage. If you work at night and you don't have to work at night, change it. Most of the
yeah,
time
I
has to do
agree.
with pay, but um, we do need nowadays some services to be available at night, such as firefighters
Yeah,
and policemen. But do we need to? Since the pandemic, I'm glad Walmart at least closes at 11. At least where I am. Used
yeah,
to be all night long, and 2 o'clock in the morning, you wanted to go to the store, you could go. Well, all these things affect you.
mm.
It's not only the blood sugar, but the blood sugar is a uh, major component. Stress in general can
Yeah.
cause metabolic dysfunction everywhere in your body.
Mm. Yeah, I really, circadian biology is very important. Having your body clock set to the circadian rhythm, the sunlight, producing hormones at the right time of the day, and getting sleep. Things that unnatural light, causes blood sugar spikes as well, cortisol production, and everything like that as well. So like blue light, and it's not healthy. So, but it all comes back to blood sugar, and these hormones that produce these the insulin response and things like that. So that's great. Anything else?
Well, one of the things I'm gonna give you an excuse, but it's not an excuse. It's just I get up in the morning. It's nighttime. Don't want to go walking around the grass, grounding outside because I have to get ready for work. But
Yeah.
the EMF machine, sort of, it's an artificial way of doing the grounding. I think it does help. Uh, Being exposed to the sunlight at the right times also helps. Uh, and like you mentioned, if you're able to get the natural light off, there's some people who go as far as they have no lights in the at nighttime, and
Mm.
if they have lights, they're going to be wearing some ultraviolet, uh,
Yeah, blue light blocking
the
glasses.
blue light
Mm.
blockers. All these things do help to decrease some metabolic disease in your life. I don't think anybody can argue with, oh, I it's a lot of stress, but that has nothing to do with disease.
Yeah, yeah. There's just one contributor really. It's not going to be a cause of certain things. But um, as far as books, I always like to ask something like, what's your favorite book on this kind of subject on health, and what would you recommend?
Read as much as you have a long list on Audible on my queue there. Uh, but I'll tell you, going back to the subject of stress, 37 years ago, this month, as a matter of fact, I had back surgery.
Mm.
Having back surgery included before and after the surgery, I spent 39 days in the hospital as a patient. I
Yeah,
was doing my residency, so it was in the hospital where I was a resident, a doctor, and so I always say I did an extra rotation in a patient because this was during my family medicine training. Well, 39 days in the hospital can depress anybody, even people who may
yeah,
not be normally susceptible to that. And during that time, I read a book, and I think it was on audio cassette tapes, which is what we had available at the time. Uh, this was 1987.
yeah.
So, so this book was instrumental in me going through that period, and it's a book written by Robert Schuller. Uh, for those that are probably older than you and closer to my age, he built the Crystal Cathedral in California. And after he died, his son continued with that. Uh, a book called Tough People, no, uh, Tough Times Never Last, but Tough People Do. Okay?
Yeah, that sounds
And
good.
it's an old book. You can actually find it very, very inexpensive. It's an educational book. I think that helped me a lot. When I went to medical school and I started practicing, there was never patients that came to the doctor. There were some that would come doing some limited research, but they were not able to do significant research to come and show me that they knew as much as I did almost on certain subjects. Nowadays, that has changed. So everybody has a computer in their hand. They have access to the same, almost the same. I think the only difference between me and my patient is I know how to put things together quicker than, it might take you reading the same thing. Uh, I'm able to put it together quicker, but I am no longer expecting the patient that walks through my door and they, oh, doctor, I found this and this and this. And sometimes they'll show you have the subject matter, they master it
Yeah.
uh, with a lot of research. Sometimes it's you cannot believe everything you read, much less everything you find on the internet, because sometimes what you
Yeah.
find is not substantiated to any significant degree. But uh, you have such a powerful instrument now for doing research, and those that who do it, and at least if it's a scientific, they read it, they are able to draw conclusions. So patients are more informed nowadays. That keeps me on my toes, number one.
Yeah,
And
that's
number
good.
two, then I have to explain sometimes, well, uh, what you read is correct sense, but you're not taking into account these other things.
Yeah.
Uh, as far as a specific book, I would recommend you read everything you can. Uh, if you want to know more about low carb diet, textbook came out last year called Ketogenic, right? I don't know if you have it. The Science of Therapeutic Carbohydrate Restriction. Uh, Among the things that I did when I started doing more research is now I have become certified as a metabolic health practitioner, low carb practitioner, uh, because if I was going to spend this time hundreds of hours and reading a lot, then I wanted to get some continuing medical education credits for that.
Yeah. Very good.
So
Excellent. That's fantastic. Well, I won't take up too much any more of your time, but just amazing information and amazing healing that you've been going through yourself as well. And it's good to see, doctors are listening to their patients as well. That doesn't often happen these days, unfortunately. Um, yeah. So, any last words of advice for anyone listening?
do your research, but we some studies show 88% of the population is metabolically sick. Some other studies show up to 93%, which means at least 90% of the population is metabolically healthy, right?
Yeah.
So here I'm not talking to the 7 to 10% that are metabolically healthy. If you're healthy with what you're doing, continue doing what you're doing. My major interest as a physician is to heal, right? To help you improve whatever your condition is. And if you're healthy, you can. I don't know what you're still doing here, go. But if you're not healthy, you need to down. You need to research. Uh, if someone if someone is vegan, vegetarian, Mediterranean, pescatarian, it doesn't matter to me as long as you're healthy.
Mm.
If you're not healthy, almost
You need to make
100%
some
of the
change.
time, I find they are having chronic, excessive carbohydrate consumption.
Yeah.
Okay. And that
Yeah.
starts a chain of events that goes down into 30 to 50. different things that can
Yeah.
improve if you out. Of course, we didn't talk much about processed foods and vegetable seed oils. Uh, but if you really cut out all the processed foods, you're cutting out the refined sugar and refined oils.
Yeah.
Um,
Yeah. Maybe next time we can talk a bit more about that, because there's these any ultra processed foods are just absolutely toxic, really.
yeah.
Just laden with these seed oils and other things.
And the major pushback I get from certain people convinced that meat is evil, or you know, we've been hearing for 50 years decrease your red meat.
Yeah.
Red meat consumption in the United States has steadily decreased over these past 50 to 60 years.
Mm.
Consumption of saturated fats has decreased as well in a parallel manner.
Yeah.
Yet the incidence of diabetes, cancer, cardiovascular disease, and all these things continues to skyrocket.
Mm.
So I don't know.
Exactly.
And then people like we were. Uh, you had a live last night, right? And I'm not gonna mention his name because I'm not trying to bash him, but someone who was debating with a carnivore, and he is first of all quoting a 5 day study.
Yeah.
It doesn't matter what the 5 day study is. There is no 5 day
Yeah.
study that's going to convince me to change the way I eat. If you want to convince me, you got to give me a little bit better evidence. So they are convinced red meat, for example, causes cancer and causes this and that. There is no reliable study because all of those are epidemiological studies, most of them just patient questionnaires.
Mm. Yeah,
Count a
there's
lasagna.
no controlled study on nutrition ever. There's never been one. You can't do it because basically they're just
You,
questionnaires, and especially in a 5 day process, like we said before, these things that these diseases are decades in the making. Like
yeah.
5 days is nothing.
So, there is no studies to prove. There's no studies to prove red meat is good or bad, or a vegan diet is good or. I mean, a true randomized double blind controls. I mean, it doesn't exist. It's not going to exist because will be almost unethical because you cannot do it double blind, right? You have to say,
Yeah.
okay, do you want to eat this way or this way? And then we're going to study. But you would have to have people 10, 20, 30 years doing the same thing to be able to come to real conclusions. Now, I am following a 64-year-old experiment that I pay attention to, and that's
Yeah.
me.
Exactly.
It's an N1 experiment. This is the best way I have found to control and reverse multiple medical problems, sometimes insignificant as having a toenail fungus, which is gone from one toenail that I had fungus at. And it might sound stupid to some, but I didn't know I could do that by following a very low carbohydrate diet.
Yeah.
Okay,
Yeah.
so
Just one of the other many. Excellent. Well, I won't take up any more of your time. So thank you again. I really do appreciate you taking the time to speak with me today, and I really enjoyed hearing your story. It's absolutely amazing. Um,
thank you for
okay.
having me.
Anytime. Absolutely.